Peripheral neuropathy is nerve damage caused by a class of drugs that we use commonly in breast cancer called the taxanes. So neuropathy is nerve damage that can cause numbness, tingling, pain. It can be really limiting in terms of quality of life and everyday functioning of patients, but it's also important because it's the primary reason why we have to reduce the dose of life-saving chemotherapy. Black women have much higher rates of neuropathy, and that neuropathy tends to be more severe and it's more impactful. We're seeing more dose reductions in Black women and ultimately reduced survival because of all of this. The most important implication from this study for Black women with breast cancer is that we found that a specific chemotherapy drug, docetaxel, was associated with significantly less neuropathy compared to a drug called paclitaxel in Black women. Paclitaxel has previously been our standard of care, but based on EAZ 171, docetaxel may be the preferred drug specifically for Black women because we saw less neuropathy and we saw less dose reductions of life-saving therapy. This just really starts us down a whole line of research where we stop just describing that there's a disparity in breast cancer outcomes and we actually start to change our practice so that we're intervening on it. And I think moving towards that next step is what makes me really excited about this line of work.
So given the disparities that we see with Black patients in terms of survival and toxicity, we felt compelled to address this head on and design a clinical trial built specifically for this underrepresented population so that we could try to better personalize our medications and try to improve outcomes in all ways. But the idea of how to do this and how to do it well is really a manifestation of a lot of people and a huge and amazing team, including our patient advocates and a number of really amazing disparities thought leaders who've really helped guide us so that we could do this the right way, and indeed something we're very proud of.
Pink Forever's mission is to eliminate breast cancer disparities in the community through education, empowerment, advocacy, and research, with a specific interest with Black women. This is huge news from an advocacy standpoint. It is to teach and to talk about so folks can plan around their survivorship, what to expect, expectations, and some limitations as well, and to be informed. So this is super exciting. Just for the community at large, specifically Black breast cancer patients.
One of the things that we do at Pink Forever is to partner with researchers so that we can give a community-based and advocate-based influence on the design of the research. In this particular study, we helped recruit some breast cancer survivors who then participated in study groups to help guide how can the study be shared with breast cancer patients? What's the best way to reach them? When does it make sense to introduce it? How should it be introduced? With these kinds of studies is what will eventually improve breast cancer outcomes for Black women. That's important.